So just quickly check the phone. एक बार शुरू हो जाएगा. So today I'm going to be taking a very important topic, middle ear guys. I know it's not a very long topic but it's a very important topic. तो मुझे लगा आज इस पर थोड़ा सा time spend करके let us explain this to you in detail. Basically what are the boundaries of the middle ear and what structures pass through them. इसमें हमेशा whatever kind of question paper it is, whether Indian or international or FMGE or NEET or whatever it is, there is always a question that is asked from this. So let us see what is there. If you have any other questions on this, feel free to ask me directly as well. So streaming has not yet showing. Now it is. There it is. So maybe there is about a 15 to 20 second lag. All right. So today I am going to be teaching you this with a little bit of craft work. I'm सोचा थोड़ा सा जुगाड़ innovation को लाए. So if you want to do this with me, or if you want to understand the middle ear, you can create like a small box like this. You can buy a box or Amazon से तो कुछ ना कुछ order करते हो and take a box like this. And one side open and a small cube like this will help you understand the middle structures like I will explain to you today. This is my makeshift stapes. Actually it is a tuning fork projecting out from the other side, but I think the rest of it is as close as it gets to the stapes that is below is around when I'm going to walk you through all of this, and let's take the middle ear one by one. See, one of the reasons why middle ear is considered a little confusing always is because of the orientation. Okay, now when we do our anterior, posteriors, medial, laterals, we do it in the cadaveric position. लेकिन जब हम middle ear में आते हैं, yeah, when we look at the middle ear, then our view is from this angle. Okay, when our view is from this angle, what happens is then our orientation completely changes, because what is medial and lateral like this is basically anterior and posterior when you look from the side view. And that's why sometimes when you are looking at these diagrams, they are made from this viewpoint as if you are looking like this, but all the explanations are medial, lateral, superior, inferior, which sound very different because it is in this orientation. That's why confusion hota hai. So sometimes the way I used to remember it, I used to imagine myself in a room. A room is a very good example. Take one as the tympanic membrane, lateral wall, other one as the promontory, medial wall, anterior posterior wall, and you will be able to understand everything. Or you can create a box or a cube like this for easier spatial understanding, because thoda three-dimensional hai. All right, so our first one is let us look at the tympanic membrane. I have removed the tympanic membrane over here. Tympanic membrane forms the lateral wall, and tympanic membrane mein question jo aata hai normally ye hai ki this is originated from all the three germ layers. Okay, from all the three germ layers, mesoderm, endoderm and ectoderm. The mesoderm forms a fibrous layer. So if there is any tympanic membrane perforation or any sort of injury, the fibrous layer does not heal. So a healed tympanic membrane will always be thin. It will be very, very translucent, and in some image based exams you may even confuse it to be a perforation. Only way to know whether it is a tympanic healed perforation or an actual perforation is that the healed perforation will give you a reflection cone of light, or whatever light source you are using. Use a light source very close to the healed perforation, it will start giving you a reflection. Okay, so in tympanic membrane here, basically also called as the pars tensa and pars flaccida. So pars flaccida is this part above, this is the pars flaccida, and the one that is the tense part is the pars tensa. All right, the angle पूछते हैं what this is. The angle of the tympanic membrane is not straight in the ear canal, it is angled in an acute 45 to 55 degrees. Cone of light is one way. Now whether this is a right or left ear, one of the ways I remember it is the cone of light forms the R if it is right. So अगर मैं इसको ऐसा line draw कर लूँगा, then it look like an R, it is right. The illogical way है, some people prefer that, but if you want to use a logical way, then the cone of light is always pointing anteriorly. Cone of light and the short process, this is the short process of the malleus or the lateral process of the malleus. The bony structure doesn't always go away. Even if the drum has got total perforation, you will see the short process of the malleus, also called as a lateral process. बार बार दोनों बोलना पड़ता है, जैसे आजकल बोलना पड़ता है हर किसी को एड्रेस करते समय. This also prefers to be addressed as short and lateral. And so this will always be anterior. Anterior matlab front. So this will be the right ear. If this is the right ear, then only these two things will be pointing front. Otherwise, you can use this illogical R way also. Okay, where if it does not form the R, it is not the right ear. All right. Diseases, meningitis bullosa is the most, it's very painful, multiple bulbous structures. But this question is commonly being asked about multiple perforations of the eardrum associated with no pain. Whenever there is no pain, it is always a hint towards tuberculosis. The only place where tuberculosis is painful ever in the body is laryngeal tuberculosis, where it has the rat nibbled, mouse nibbled appearance, and it is extremely painful. Otherwise, most other conditions, tuberculosis is considered to be very slow, very chronic, very painless. These kind of small multiple perforations. So, uspar questions aa chuke hain, so I'm putting that out. Okay, so let's, before we go to the walls, these are the three bones. For people who don't know, there is a malleus, which is this bone. Malleus means hammer. Okay, it means hammer. So it's like the malleus or the hammer. Incus is like the anvil, just pe hum nail marte hain. And stirrup is the name given because earlier we didn't have cars. We used to travel by horses. When the doctors who came up with this name, this is stirrup, is where you keep your foot and ride on a horse. This little thing that is there, it's called as the stirrup or the stapes. Okay, so let's talk about the lateral wall first. Before we go to the walls, this prosac space is very important. इस पे बहुत सारे question आते हैं and that's because also cholesteatoma का source is very much related to this prosac space. Prosac space, as you see, is in the pars flaccida, also called as the Sharpnell's membrane. Okay, sometimes they call as the pars flaccida as the Sharpnell's membrane. So this part over here is the Sharpnell's. So as you can see, this top part where it is mentioned prosac space, that is behind the pars flaccida or the Sharpnell's membrane, and it is bounded posteriorly by the neck of the malleus and anteriorly by the pars flaccida, and then the lateral and medial malleal ligaments, they form the superior and inferior parts. All right. Now, structures of the middle ear cavity. This diagram you see seen everywhere. It's quite confusing. इसको थोड़ा सा सिंपल तरीके से लेते हैं by looking at this particular box-like structure. Okay, so I am looking at this as the right ear. So when I'm taking the right ear, okay, when I'm taking the right ear, sorry, like this. Okay, this is how it will be when it is a right ear. This is the tympanic membrane, and what you're seeing over here is the posterior wall. Okay, so tympanic membrane is here, हटा दिया है, and this is the posterior wall. So if that happens, then this becomes the anterior wall. Okay, the anterior wall. ऐसा देखो, anterior wall means front, right? So what are the structures that are there in the anterior wall of the middle ear? All right, so there are basically 4 structures in the anterior wall. There is one nerve, one muscle, one tube, and one artery. Okay, artery, nerve, muscle, and tube, one of each. So if you look at this as the anterior wall over here, what is the nerve? The nerve is the chorda tympani nerve. The chorda tympani nerve basically coming out from this part which I'm showing you over here below. This nerve is traveling from the posterior wall. It is taking a branch from the facial nerve, going along the floor little above and exiting like this. Why does the chorda tympani nerve have to go anteriorly? Because it supplies anterior 2/3 of the tongue for taste. So of course it has to go from anteriorly, but the facial nerve is posterior. Facial nerve exits from the stylomastoid foramen. It is coming over here posteriorly, right? So it has to give a branch that goes from posterior to anterior like this. Okay, so it goes from posterior essay to anterior, and it comes out from this opening like this, and it goes downwards, then supplies the anterior 2/3 of the tongue. So chorda tympani is the nerve. This is the artery. Very closely associated is the internal carotid artery. So this is the opening of the eustachian tube. Okay, so this is the opening of the eustachian tube, and eustachian tube is going downwards anterior like this. The chorda tympani nerve is the internal carotid artery is right there. So I am one of the few surgeons in India who does something called as eustachian tube balloon dilation. इस eustachian tube को हम लोग balloon डाल के dilate करते हैं to evacuate any mucus plug that is stuck over there and to reverse any inflammatory process. One of the most important things that we have to do in a high resolution CT scan is look for dehiscence of the carotid canal with the eustachian tube. If there is a dehiscence, we cannot, it's an absolute contraindication, because when we are going to dilate eustachian tube, the bony part, if it cracks up and it causes an internal carotid artery bleeding, it is going to be fatal. There is no way to stop that bleeding because it's housed inside the temporal bone. आप pressure भी नहीं डाल सकते, कुछ नहीं कर सकते. So it's a very difficult situation. The internal carotid artery is very closely related to the eustachian tube. It is and the anterior wall. Okay. Now the eustachian tube is the tube that is there. Of course, the eustachian tube has to come from the ear all the way to the nasopharynx. So it has to move down anteriorly. So it is the tube that is present anteriorly and goes downwards. So you have the chorda tympani nerve, you have the internal carotid artery, and you have the eustachian tube. Then what is the muscle? The muscle is the tensor tympani muscle. As the name suggests, tensor tympani, it has to tense the tympanic membrane. Now here's a very interesting physics challenge. Tympanic membrane is like this, right? Tensor tympani muscle originates from this side, from the eustachian tube area, right? Now how is it going to tense the tympanic membrane? If it is connected sideways like this, right? Suppose if it is coming sideways like this, it will tense the tympanic membrane towards one side. When you want to tense something, you want to pull it back straight. It's a very interesting thing that the tensor tympani muscle does. Tensor tympani muscle, it goes from here, okay, near the eustachian tube, it goes inside like this, and it hooks around the cochlea. It hooks around the basal turn of the cochlea, called as the processus cochleaformis, and then it comes straight and attaches to the neck of the malleus. So it is basically like an L-shaped hooked around the process. So when it tenses, it basically pulls the tympanic membrane back in a straight direction, even though its origin is from the side. So वो side से control कर रहा है through the processes of the It's a very interesting adaptation of the human body. As you know, middle ear is not designed as an original way of hearing. We were water animals, and our hearing was purely wave based. Very simple. पानी से wave आ रहा है, अंदर cochlea का पानी हिल रहा है. But some outgoing futuristic people thought, why live in water? We can walk on land, and then reptiles and propagation birds, your apes and all of those things happened, and then our body had to adapt to hearing outside. This is from air into water. So air to water conduction के लिए we had to use all this bone and this middle ear apparatus. That's why a middle ear is developed from the pharyngeal arches, so that we are able to hear, and that's why all these structures had to take adaptation. Those three ossicles like the malleus, incus, stapes, they're all there to convert this sound energy in air and move the waves into water. In for that transition there. Okay, so the four structures in the anterior wall, I don't think it is very easy to forget. One nerve, one muscle, one tube, one artery. Chorda tympani nerve coming out from the floor part, then carotid artery, the eustachian tube opening, going inside from the lateral wall, from the anterior wall, hooking onto the medial wall, which is on the promontory around the cochlea, called as the processus cochleaformis, and go straight to the neck of the malleus and pulling it back to tense. Okay, anterior wall is sorted, right? So anterior wall is this wall. Okay, if I'm looking this way, this anterior wall is sorted. Now let us see what are the structures in the posterior wall. Now the posterior wall is this wall. Okay, the posterior wall is this back wall over here. Now the interesting thing about the posterior wall is your facial nerve goes from here, the vertical segment of the facial nerve. Look at this as the middle ear, right? Your and this is the posterior wall, and this is the medial wall. So facial nerve actually is coming from this direction, coming like this, and then here it takes a bend called as the first genu. First genu is a bend like this, and then it comes like this through here and takes the second bend and down straight along the posterior wall. First genu, it gives a lateral suprapetrosal nerve that supplies the tear glands, the secretomotor aspects. That's why when we have facial nerve palsy, there is dryness of the ear or the dryness of the eyes, or because it supplies the tear gland, right? So when it is coming from the internal acoustic meatus is along the lines of the external acoustic meatus. ये tympanic membrane है, ये external acoustic matrix है, internal acoustic matrix is like this. So it is coming straight like this, and then it takes the first bend. When it takes the first bend, it supplies to the eyes this side, right? Eyes are medial to the ear. अगर ये right ear है तो eyes medial है. So it supplies this way, and then it takes that bend and it goes down. So your vertical branch of the facial nerve is there on the posterior, right? Then there is the pyramid. Okay, this is the pyramid. The closest that I can show is the pyramid is this particular thing, and as you can see, it is very close to the stapes. From this pyramid, there's a muscle comes out called as the stapedius muscle, and this stapedius muscle connects and attaches to the stapes, neck of the stapes, right? So then it will tense, making this sound. It will tense and stop the stapes out. So in the posterior wall, you will have the vertical segment of the facial canal going over here. This facial canal vertical branch gives two branches. One is it gives this nerve to the stapedius. Okay, it gives nerves to the stapedius. Other one is, I already told you, it gives a cauda tympani nerve. Cauda tympani nerve that goes from this posterior wall all the way to the anterior wall. So these are the two nerves. Of course, the pyramid will be there, and this muscle. These are all the posterior structures that are there, right? Got it? So anterior, we have four things: cauda tympani nerve, eustachian tube opening, internal carotid artery, tensor tympani muscle. To the wall, you have the vertical segment of the facial nerve and the pyramid and the stapedius muscle, and the two branches that the vertical segment of the facial nerve gives. One is the cauda tympani nerve, other is the nerve stapedius. Okay, so now coming to the most complex part, which is the medial part. Now medial part has some important structures. One of, as you can see, the circle that I've drawn over here is the promontory. Promontory is the projection of the basal turn of the cochlea. Okay, this is where the basal turn of the cochlea is there. So अगर आप पीछे देखोगे तो cochlea is basically turning like this. So the basal turn, then it turns 2 and 3/4 time, the modulus. So this basal turn of the cochlea, जो मेरा ऐसा this का projection है, this is the projection that will be there over here, and on this there is a plexus of nerves called as the tympanic plexus. All this plexus forms part of the glossopharyngeal nerve, and it supplies a nerve called as the Jacobson's nerve that then goes down the floor here down, supply the posterior part of the tongue, right? And there are of course two important windows. एक तो यहाँ मैंने ये tuning fork अटकाया हुआ है. This is oval window. Oval window में the foot plate of the stapes there, and below that is the round window. Okay, so you can see round window here. The oval window is where the foot there. Round window is also called as the secondary tympanic membrane. When you sometimes look at the ear drum, you can sometimes see this little dark circle down in the posterior inferior segment. That is the round window. This round window has a lot of importance because one is that it allows all the waves to subside by giving the recoil, and also when you're doing cochlear implant surgery, it is this round window into which you want to insert the electrodes of cochlear implant. So the round window and oval window are here, and then the promontory and the Jacobson's nerve plexus, which is the glossopharyngeal nerve plexus that forms the Jacobson's nerve, which goes inferiorly. Okay, so the Jacobson's nerve नीचे से जाता है. Right, so the Jacobson's nerve inferiorly, right, you can see. So that is what it is. थोड़ा craft करना भी, right? So understood? Promontory, Jacobson's nerve coming out from the glossopharyngeal plexus, the foot plate of stapes of the oval window, and the round window, the structures of medial wall. The medial wall. If I'm turning around this side, how the orientation wall, posterior wall, medial wall, lateral wall over here is the drum. Okay, so you're able to get that orientation here. So let's now see two other important structures over here where the marks come and questions are asked, and it's always a little confusing, which is the sinus tympani and which is the facial recess. And this part is where I need your attention. Okay, so as you can see, this is the pyramid. All right, and this pyramid is the stapedius muscle attaches and connects to the the head of the stapes over here. Now if you can notice, there is this space that is there, medial matlab ye andar wala space, this is the medial, this is lateral towards the eardrum. Okay, this medial space that you can see is the sinus tympani, and the sinus tympani is a very important space because when we are drilling from the posterior side, we are drilling from this wall over here, right? This is where the posterior aspect, in the drill over here, we are unable to access this part because ekdam khopche mein, corner mein, and here it looks very big. In reality it is very small, few millimeters in diameter, and sometimes some cholesteatoma can be left behind there, then it will recur from that place. Okay, so this space that is there over here, this part, more medial inside part, is called as a sinus tympani. Sinus tympani is always medial to the pyramid. इधर आपको दो वर्ड मिलेंगे जो कभी समझ में नहीं आते, वो है subiculum and वो है ponticulus, and this is the boundaries of the sinus tympani. अभी lateral and medial boundary में कोई confusion नहीं. Lateral boundary is the pyramid. Okay, pyramid is lateral because sinus tympani is medial, it is inside. And what is there on the posterior wall over here, right? Posterior wall behind near the promontory is the posterior semicircular canal. Lateral semicircular canal ऊपर है, posterior semicircular canal is behind, is here. So posterior semicircular canal forms the posterior the medial wall, and lateral wall is formed by the pyramid. Now what forms the superior and inferior wall is this subiculum and ponticulus. Two complicated words तो कभी किसी को याद नहीं रहते, and I will tell you how to remember. What is the subiculum and ponticulus? It's a very simple way I'll explain to you. If you take atta or dough, right, and you make a thin ball of atta and dough, and you take two 1 rupee coins and you put one coin above and one coin below, you will see in middle there is a projection coming. One projection coming below the superior coin and one projection coming below the above the inferior coin. These projections are what these subiculum and ponticulus are. They are projections on the promontory after the oval window and round window are there. Subiculum is the inferior one, ponticulus is the superior one. Ponticulus, superior ka P, बोलोगे superior का S क्यों नहीं है? That's why I never believe in these mnemonics. But the superior का P में ponticulus है, but subiculum के है नहीं. Subiculum में कुछ है नहीं. But that way, I don't want you to remember it. But the ponticulus is basically below the oval window. Subiculum is above the round. These are what form the superior inferior boundary of sinus tympani. Sinus tympani is usually the place where cholesteatoma is left bare. And the part that is there lateral, which is all of this part, ये सब part जो है इधर between the annulus, this is the annulus of the tympanic membrane, right? The annular ring and the tympanic membrane. ये annulus के बीच में से लेके pyramid तक लेके, this is all the frontal. Frontal recess is always lateral. It is lateral to the pyramid. Sinus tympani is medial to the pyramid structure. Slowdown is saying audio issue breaking in between. Okay, tell me what part you did not hear. I'll repeat it. Okay, but otherwise I think because I was a little away from the mic, or if I turn my face around, the voice break hota hai. So I will repeat it again because we're not taking any other topic, we're just doing this. So if you want me to repeat something, I will repeat something, the same thing for you. Okay, so what part you did not listen, I will tell you. But just to recap, because slowdown is asking me to slow down a bit, I will tell you what the boundaries of the middle ear are again. Okay, so this where my hand is. Okay, this is the lateral wall, this is where the eardrum is. This is the lateral wall, this is the right middle ear. So lateral wall, if I'm turning this side, this is the right middle ear. Lateral wall, tympanic membrane. This is the anterior wall. Okay, anterior wall में क्या structures आते हैं? There is a chorda tympani nerve, there is the internal carotid artery, there is the eustachian tube coming out, and there is a tensor tympani muscle. Posterior wall, you have the facial nerve canal, which is the main thing, pyramid, which is there over here, and the stapedius muscle, and two branches that come from the vertical branch of facial nerve, which is the chorda tympani nerve and the nerve to stapedius. Medial is this part, which you can see, promontory, where I made this little circle over here. That is the promontory, basal turn of cochlea. And you will see a plexus of nerves called as the Jacobson's nerve plexus. From the glossopharyngeal plexus, that forms the Jacobson's nerve that goes down, And then you have this oval window where the footplate of stapes is, and you have the round window, which is that circular thing that I have made below it, right? So this is all the medial wall. Now what is left is the sinus tympani. Sinus tympani I've explained to you. If this is the pyramid and this is the pyramid that is supplying this, the stapes muscle is originating from the pyramid and attaching to the stapes over here. So ये जो space पीछे बन रहा है, you know, basically this space over here inside where the scissor is pointing towards, this medial space is the sinus tympani, bounded superiorly by ponticulus, inferiorly by subiculum, laterally by pyramid, and medially by the posterior semicircular canal. And ये जो space है, all this outside space over here, lateral space, lateral to the pyramid, this whole space is the frontal recess. Frontal recess is very important because when we are drilling, right? So when we're drilling from the posterior wall. As you can see, there's so much of space to drill over here. When you drill over here and you enter, the first thing that you will point is that this round window will become right in front of you when you are drilling. This round window is a small circular opening below. So if I'm coming from here, drilling, I'll easily be able to pass the electrode of a cochlear implant into this round window. And most importantly, there are no important structures. Okay? So there are no important structures, because only thing is medially there will be the facial nerve canal. I'm coming lateral to it. So if I'm lateral to it, between the eardrum and the facial canal and the pyramid, absolutely clear, I can safely pass the electrode for cochlear implant. And that is the importance of the facial recess. All right, so now that we have explained these parts, the other two parts are not difficult. This is the roof. Roof is a tegment tympani, it is above, right? Either editor side antrum aata hai, idhar se antrum banta hai. And in the floor you have the jugular bulb that is there in the floor, and your glossopharyngeal nerve ka jo branch hai, Jacobson's nerve, that comes down from the floor. That's why when you have glomus tumors, this glomus tumors comes from below and causes the rising sun sign, or it causes the rising sun sign from below. Some people say, why you don't call it setting sun sign? So it is also called setting sun sign as long as the sun is going up or down. All right, so I think if you, for middle ear, you have to spend some time to give it some three-dimensional approach. If you give it that three-dimensional approach, it will be easier for you to answer these questions. Okay, so this is the image of the sinus tympani. So let me explain it to you. The superior ponticulus projection, which is below the oval window, and horizontal segment of facial canal, and inferior subiculum is the projection above the round window. Okay, so like I said, if you take आटे का गुदा, or if you take some sort of dough and you put two coins, you will see that below the first coin you will see a small projection, and above the below coin you will see a small projection. That projection is basically what happens on this promontory also when the bones ossify and the membranes are formed, right? So here you can see the which is marked. You can see the sinus tympani which is there up between which is above the round window and below the oval window, and the facial recess is lateral, right? So as you can see, this is a side view, and in this side view also you can see the sinus tympani which is marked between the stapes and the pyramid. The facial recess is all the lateral part. It is near between the eardrum or the annulus of the eardrum and the facial canal, right, or the facial nerve, and the chorda tympani nerve crosses obliquely to it, right? Laterally is a tympanic membrane, just the eardrum. So you'll see the malleus and all the malleal ligaments, and the tympanic membrane, all of that forms the lateral part. So if you look in this box, it is the part which I have removed over here. So this would be where the eardrum is. All the structures laterally would be the malleus, inguinal joint, and the eardrum itself, right? And superior is a tegment tympani. It's a very thin plate of the petrous temporal bone separating the middle cranial fossa. Many times this question is asked. They'll give anterior cranial fossa, posterior cranial fossa, but it is a middle cranial fossa. Big hint. Fossa cranial here, there. So that is one way to remember that. And floor, of course, internal jugular vein and the tympanic branch of the glossopharyngeal nerve, called as the Jacobson's nerve, that goes and supplies the posterior aspect of the tongue. All right, guys. So with these boundaries, I think you can revise this video. I just put this exclusively for the boundaries of the middle ear. so that it's easy for you to recap. The simple way is to take and make a box like this and just use some simple structures. I have used a tuning fork to make the stapes, or you can sit inside a room and imagine all of these structures. Once you've got the spatial recognition of the structures, then the diseases and the surgical steps and all of that become very easy. If you have any questions, you can ask them to me in the comment section. I'll be happy to answer. Otherwise, that's the quick revision of the middle year anatomy, and I'll come back with more topics very soon. Signing off, Dr. Jagdish. Take care. Bye bye.